You're sitting at the kitchen table, morning light coming through the window. You've got your pill organizer open, the little plastic one, 7 compartments, one for each day, and you shake out the same small white tablet you've been taking every single morning for the past 6 years. You swallow it, you drink your coffee, you don't even think about it anymore. It's just part of the morning. That's exactly what Carol Simmons was doing 14 months ago. Carol is 67 years old, retired school principal from Boise, Idaho, sharp as a tack, does crosswords in pen, walks 3 miles every morning without fail. Her doctor put her on lisinopril 6 years ago when her blood pressure crept up to 148 over 91. She took it without complaint. She did everything right, never missed a dose, showed up for every follow up, even cut back on the salt she sprinkled on her eggs, even though she told me that was the hardest part. Then one afternoon, Carol's neighbor, a retired pharmacist named Doug, mentioned something at a block party that stopped her cold. He said, "You know, blood pressure medication isn't always a life sentence." Carol went home, she opened her laptop, she started reading, and by midnight she had convinced herself of two things. One, that she had been over medicated for years, and two, that she could simply stop taking her pill and her body would reset on its own. The next morning, she didn't open the pill organizer. By day 4, her blood pressure was 171 over 104. She didn't know that. She felt fine. That's the terrifying part. My name is Dr. Kald. I'm a cardiologist. I've been practicing for 32 years. And the conversation Carol's neighbor started but didn't finish is one I've had to finish for my patients more times than I can count. Because Doug was right. He just left out the most important parts. Today I'm going to give you the complete picture, not the alarming version, not the dismissive version, the real one, the one that actually helps you make a decision your body will thank you for. Here's what I can tell you right now. Out of every 10 patients I see over the age of 60, roughly 3 to 4 of them are either already wondering if they can get off their blood pressure medication or they've already tried quietly without telling anyone. That number surprises people. It shouldn't. It's a completely reasonable question that most doctors don't leave enough time to answer. So, the question we are answering today is this: can someone who's been on blood pressure medication for years actually get off it safely? And if so, what does that actually take? Subscribe right now. I publish every single week specifically for people who deserve to understand what is happening inside their own bodies, not just be handed a prescription and sent home. Here is what I want you to hold on to. By the end of this video, you won't just know whether coming off blood pressure medication is possible. You'll understand something most people in your position never get told. Why can I stop is actually the wrong question, and what the right question is. The water tower and the rusty valve. Think of your cardiovascular system like a town water tower. The tower holds pressure. That pressure pushes water through every pipe in every house in town. Without enough pressure, nothing works. Too much pressure and pipes crack, joints fail, the whole system starts to wear down faster than it should. Your heart is the pump that fills the tower, your arteries are the pipes, and blood pressure, that number your doctor reads every visit, is simply a measure of how hard your blood is pushing against the walls of those pipes. When that number is too high for too long, it does damage, quietly, without symptoms. That's why it gets called the silent killer. Your pipes are under strain and you feel completely normal. Medication like lisinopril or amlodipine doesn't cure high blood pressure. It manages the pressure. It's not fixing the rusty valve, it's turning down the water flow so the pipes stop taking damage while you address whatever caused the pressure to build in the first place. Here's what that means for you. If the underlying cause of your high blood pressure is still present, stopping the medication removes the protection without removing the problem. But, and this matters, if the underlying cause has changed, the math changes too. Harold Bennett is 63 years old, former warehouse manager from Tulsa, Oklahoma. Big guy, proud of it. He was put on blood pressure medication at 58 when he weighed 247 pounds and his pressure was consistently running at 155 over 95. Over the next 4 years, Harold lost 41 pounds. He did it slowly, seriously. He changed what he ate and started walking, then eventually jogging on a track near his house. At his annual physical, his doctor noted that his blood pressure had been running at 118 over 74 for the better part of a year. Harold had been waiting for someone to bring it up. No one did. He assumed that meant he needed the medication forever, that the medication was the reason his numbers were good, not the 41 pounds. He never asked, his doctor never offered, he just kept taking the pill. When Harold finally brought it up at a visit, almost nervously, like he was confessing something, his doctor looked at his chart, looked at Harold, and said, "Honestly, we probably could have had this conversation a year ago." They did a supervised taper. Harold has been off his blood pressure medication for 14 months. His pressure averages 121 over 76 without it. If you've made significant, sustained lifestyle changes since you were first put on blood pressure medication, weight loss, diet changes, exercise you've maintained for more than a year, bring this up at your next visit. Don't wait for your doctor to offer it. They are managing dozens of patients and they need you to flag it. Section 2. The number isn't the whole story. The speedometer and the road. Your blood pressure reading is like a speedometer. It tells you how fast you're going right now. But it doesn't tell you what kind of road you're on, how long you've been driving, or what's around the next corner. A doctor doesn't make treatment decisions based on one reading, or even 1 year of readings. They look at the whole road, your age, your family history, whether you've had any cardiovascular events, whether you have diabetes, whether you smoke. A blood pressure of 138 over 86 in a healthy 58-year-old woman with no family history of heart disease is a very different clinical picture than the same number in a 64-year-old man who had a minor cardiac event 3 years ago. This is why the decision to come off blood pressure medication isn't a number decision, it's a risk profile decision. Margaret Flores is 65, retired librarian from Savannah, Georgia. Meticulous. She keeps a health journal, paper, not an app, where she records her blood pressure every morning before coffee. She came to me with 6 months of data, organized by day of the week, with averages calculated by hand at the bottom of each page. Her numbers had been excellent. She wanted to stop her medication. What Margaret didn't know, what her journal couldn't capture, was that her father had died of a stroke at 68, that her own LDL cholesterol had been slowly creeping upward, and that the combination of those factors placed her in a category where her doctor wanted a comfortable buffer built into her blood pressure targets. Her pressure was good because the medication was working, not because the underlying risk had disappeared. When Margaret and her cardiologist sat down with all of that information together, the conversation changed. They didn't abandon the idea of a lower dose. Her numbers genuinely supported reconsidering the amount she was taking. But stopping entirely wasn't where the evidence pointed for her, specifically. She left that appointment not disappointed. She left it finally understanding her own situation clearly for the first time. If you have a family history of stroke, heart attack, or early cardiovascular disease, or if you have diabetes or kidney disease, these are factors that must be part of the conversation before any change is made. Know your full picture, not just your morning reading. Section 3. What getting off actually looks like. The thermostat that forgot its setting. When your body has been operating with medication regulating your blood pressure for years, it adapts. Not permanently, not irreversibly, but your vascular system calibrates itself around the new environment. Think of it like a thermostat that has been set to 68 degrees for so long, it's forgotten it was ever set to 75. When you remove the medication abruptly, the system doesn't smoothly transition, it overshoots. Blood pressure can spike, sometimes dramatically, in the first days after stopping, even if your underlying condition has genuinely improved. This is why you hear doctors use the word taper. It means slow, supervised, monitored reduction, not stopping, reducing, watching, adjusting. This is not a process that takes a week. For most patients, a responsible supervised taper takes 2 to 4 months. with blood pressure checks scheduled every few weeks so there's data, not guesswork, driving the decision. James Whitfield is 69 years old, retired electrician from Spokane, Washington. Practical man, doesn't like anything he considers unnecessary. When his new primary care doctor suggested they consider reducing his blood pressure medication, his numbers had been excellent for 2 years and he'd lost weight and given up most processed food. James assumed this meant stopping. He halved his dose on his own the first week and stopped entirely the week after. By day 10, he was having headaches. By day 14, his wife Sandra took him to get his blood pressure checked at the pharmacy. It was 168 over 101. James went back to his doctor and said, and I'm paraphrasing here, "Well, that didn't work." His doctor explained the thermostat. They started a proper supervised taper. 3 months later, James was on half his original dose. 6 months after that, monitoring every 3 weeks, logging readings at home every morning, he was off entirely. His blood pressure today averages 124 over 78. The outcome was the same, the timeline was longer. But the second time, nothing went wrong. If your doctor ever suggests reducing your blood pressure medication, ask specifically, what is the taper schedule? How often will we check my pressure during the process? What number would make us pause or reverse course? Those three questions will structure the whole process correctly. Section 4. The lifestyle gap nobody closes. The employee doing two people's jobs. Here is something I tell every patient who asks about coming off blood pressure medication. Your medication right now is doing a job. If you remove the medication, something else has to do that job. If that something else, diet, exercise, weight, stress, isn't genuinely in place and genuinely sustained, you have just left a position open with no one to fill it. This is the gap that causes most of the failed attempts I see. Not the taper, not the timing, the gap. People make changes, real ones, for 3 months, sometimes six, and then life happens. Routines slip, the scale starts going the wrong direction again. The medication is gone, the protection is gone, and the blood pressure creeps back up, slowly enough that no one notices for a while. Sustained is the word, not perfect. Sustained. Diane Kowalski is 64, retired nurse from Columbus, Ohio. So she knew better than most what she was dealing with, she told me, which made it worse when it happened to her. She had lost 22 pounds over the course of a year, started swimming 4 mornings a week, and worked with a dietitian to bring her sodium intake down substantially. Her cardiologist supervised a taper. She came off her medication successfully. 18 months later, her mother fell ill. Diane moved to help care for her. The swimming stopped. Cooking carefully became difficult. Over 8 months, she gained back 16 of the 22 pounds. Her blood pressure crept to 144 over 88. Diane caught it herself. She was a nurse after all, and she called her cardiologist before it went further. They had a conversation. She went back on a low dose. She wasn't ashamed. She was smart. She told me something I've never forgotten. I always thought going back on the pill meant I had failed. Now I know it means I was paying attention. If you come off blood pressure medication, you are not done. You are in a monitoring relationship with your own body for life. Quarterly home readings, annual checkups, awareness that the conditions that keep you off medication need to be maintained, not achieved once and forgotten. So, can you get off blood pressure medication at 65? Yes, genuinely. Many people do. The research supports it, the clinical experience supports it. I have watched it happen successfully in my own patients more times than I could easily count. But notice that isn't really an answer to what most people are actually asking. Most people are asking, can I stop taking this pill? The right question is, has the reason I was put on this pill changed enough, sustainably enough, in a person with my specific risk profile for a supervised reduction to be appropriate right now? Safety isn't a property of the medication. Safety isn't even a property of your blood pressure reading. Safety is a property of the relationship between your history, your lifestyle, your current numbers, and your doctor's full understanding of all three. Coming off medication is safe when the underlying cause has genuinely changed and been sustained. Staying on medication is safe when the risk profile still warrants protection. Both are safer when that conversation happens in a doctor's office with your home readings, your honest lifestyle account, and your family history on the table, instead of at a backyard block party or at midnight alone with a search engine. Carol Simmons, the retired principal from Boise, who stopped taking a pill the morning after a neighbor's comment, came to see me about a week after that 4 day experiment. Her blood pressure was still elevated when she walked in. Not dangerously, not irreversibly, but elevated. We ran labs. We looked at her chart going back 6 years. We looked at her lifestyle, still excellent. 3 miles every morning, sodium under control, healthy weight. I told her the truth. Carol, based on what I'm seeing, you are actually a reasonable candidate for a supervised taper. What you did was just the wrong way to find that out. We built a plan, a real one, with a schedule and checkpoints and specific numbers that would tell us whether to continue or pause. 14 weeks later, Carol Simmons was off her medication. She has now been off it for 10 months. Her blood pressure this morning, she texted me, yes, she texts me, she is that kind of patient, was 119 over 72. She called her two sisters that week, both of whom are on blood pressure medication. She told them what she had learned. One of them made an appointment with her cardiologist for the first time in 2 years. Carol said something to me in one of our follow up visits that I keep coming back to. She said, I spent one terrifying week convinced I'd been tricked into taking something I didn't need. Turns out I just hadn't finished the conversation. That's it. That's all it ever is, an unfinished conversation. I want to know where you are right now. In the comments below, tell me, are you currently on blood pressure medication and have you ever wondered whether you still need it? Just that. A yes or a no, or however much you want to share. Your answer tells me what to focus on next. And for everyone reading those comments who thought they were the only one wondering, you are not. Not even close. Here's the question I want you to bring with you into your next appointment or your next morning with that pill organizer. Not, can I stop taking this? Ask your doctor, has anything about my situation changed since I was first prescribed this? And if so, is this worth revisiting? That question opens the door without kicking it down. I'm Dr. Kalb. Subscribe so you never miss the conversation your health deserves. Before the moment you're sitting at the kitchen table at midnight, pill organizer open, making decisions alone in the dark. I'll see you in the next one.